Hi everybody, my name is Stephanie Howell and I'm doing this introductory video for my community nursing class at the University of Texas, El Paso, Nursing 4503. A little bit about me, I've been a nurse for about 20 years. I worked mostly in dialysis for those 20 years, ranging from in-center to home dialysis to inpatient dialysis to management. About 2.5 years ago, I decided that I needed a change and I wanted to switch fields, and I started working in women's health, and I'm absolutely loving working in women's health. I love the patients that I work with, and I love what I do right now. The most experience that I've had with community nursing would be when I worked for a freestanding clinic that's kind of located in the heart of our downtown area of the city that I live in. We provided free pregnancy tests to women who thought that they might be pregnant. We also did ultrasounds to confirm the pregnancy and determine viability, and date the pregnancy, as well as give the patient a good due date. We would also help them file for Medicaid, get their pregnancy Medicaid going, and refer them to WIC. And we also had parenting classes that were associated with this, so new moms could learn about parenting skills, that kind of thing. Currently in my position as an outpatient OB/GYN nurse for a hospital-based clinic, I feel like what we do for community nursing would be with our OB patients that we see on a more routine basis than some of our GYN patients. The OB patients come in for their prenatal visits according to how many weeks along they are, and so we get to see them more frequently and more often than some of our GYN patients who return yearly. We have a community-based program that we refer some of our patients to. It's called the Nurse Family Partnership, and it is based with one of the hospital systems in our city. They're funded by them, and it's a really great resource that we've grown to love and send some of our patients to. There are some qualifications for patients to be eligible. It has to be their first-time pregnancy. They can't be more than 28 weeks along, and they have to be within a certain age range. But this program, we send a referral off for people that qualify or are in those guidelines, and a nurse goes out to the patient's home and follows them throughout their pregnancy all the way until baby is 2. This has been a great resource for us as far as like helping reinforce the teaching that they're getting when they come into the doctor's office. The nurse at the Nurse Family Partnership is able to reinforce kind of some of the similar things that we're teaching our patients about pregnancy and health and nutrition, how to care for baby, all that good stuff. It's been a really good thing. It's also a second set of eyes in the patient's home to determine any social needs that may come up, and prompts a referral to social services as needed. The doctor that I currently nurse for is a big believer in this program, and so it's pushed quite a bit with a lot of our patient population. What I hope to gain out of this course is I hope to learn more about how to impact my community. I really believe that as patients become more engaged and more knowledgeable in their health and their disease processes, the more powerful that they become and the more healthier that they become. It puts an initiative in their hands to kind of take control of their own health and wellness. And I think that the more people that are healthy, the healthier our community is, the healthier our city is, and the better outcomes we have all around. So I think there are gaps in care for sure that are needed for community nurses to fill. And so just coming up with programs or assistance programs or just arming patients in that knowledge, I think is a very valuable resource. I'm looking forward to this 7 weeks, getting to know all of you guys, and then we're done. Can't believe it. We'll have our bachelor's degree. Woohoo! Come on. Anyways, good to see y'all. I hope to see you soon. Bye.